Dear students, we will be discussing today about psychosomatic disorder. Let's see its introduction. And this psychosomatic disorder is also called psychophysiological disorder or stress related disorder. Psychophysiological. And there are some changes in the physiological functioning of the body because of some psychological problems or stress related disorder. The symptoms of this disorder are just because of the stress, the psychological stress the person is experiencing. And there is organic pathology involved in the cause of the psychosomatic disorder. So there is an organic evidence, pathological evidence that can be seen or that can be ruled out in this case, in the case of psychosomatic disorder, whereas such organic basis cannot be identified in the somatoform disorder. We already discussed about the somatoform disorder in the previous classes. So in the somatoform disorders, an organic basis or organic pathology can be ruled out or can be identified, but cannot be identified in the somatoform disorders, whereas in psychosomatic disorder an organic pathology, organic basis is involved and can be identified. And most of the symptoms of psychosomatic disorders are generally treated in general hospitals rather than a mental hospital, even though a treatment in a mental hospital is necessary, because the symptoms of the psychosomatic disorders are not just the physical symptoms, and these physical symptoms are originated as due to the psychological stress. Okay. And let's see the definition of psychosomatic disorder. Psychosomatic disorder are a group of physical symptoms. It shows a group of physical symptoms in which the emotional factors or psychological factors have an important role in its etiology. So the cause of these physical symptoms are due to the emotional factors or the psychological factors or the psychological stress, leading to a group of physical symptoms, and such disorders are called psychosomatic. Psycho refers to mind, somatic refers to body. The psychological problems causing somatic symptoms or bodily symptoms are called psychosomatic disorders. Let's see the etiology of psychosomatic disorder. The main reason is psychological stress or the psychological conflicts experienced by an individual. Then another cause is childhood trauma. Any trauma experienced by the child as a child during his or her childhood. Then stressful life situations are one of the other reason for psychosomatic disorder, stressful life. And the next reason is, next etiology is individuals who have difficulty to speak or express their emotions. They are unable to speak or unable to express their emotions. Those psychological problems remains within the individual, and it is not been resolved, and these psychological stress causes a lot of problems. These psychological problems are being converted into physical problems, and that is one of the etiology. Then altered functioning of the autonomic nervous system, some problems with the autonomic nervous system, and sometimes cultural factors are also may contribute to the development of psychosomatic disorders. So the main reasons are psychological conflicts, childhood trauma, stressful life situations, and the person who is unable to speak or express their problems, psychological problems, and if they have a autonomic nervous system problems with the functioning of the autonomic nervous system, and some cultural factors may also contribute to it. Let's see the clinical manifestations. What are the symptoms exhibited by a person having psychosomatic disorders? And here the patient might be having a group of symptoms, physical symptoms, for which they would have already taken medical help or would have consulted many doctors. And let's see the symptoms that are usually there in the cardiovascular system or the cardiovascular system disorder. So in that, one of the commonest symptom of the psychosomatic disorder is hypertension. Whenever a person is experiencing a psychological stress and a psychological conflict, which is then that lead to increase in the blood pressure, causes hypertension. And there may be coronary heart diseases because of the psychological problems. There may be coronary heart disease, there may be mitral valve prolapse or CVA, cerebrovascular accidents. These are the symptoms or manifestations that can be seen in the cardiovascular disorders. Okay, for which the person would have taken medical advice, medical help, consulted many doctors. They would have changed many doctors, and they might not be satisfied with the treatment that they received, and they are unable to realize the fact that their problems are not just the physical symptoms. Their problems has a basis on this based on their psychological conflicts or psychological stress. And respiratory system disorders, there may be problems that the person may exhibit in the respiratory system, or there may be asthma, bronchial asthma, hyperventilation syndrome, or rhinitis. These are the manifestations in the respiratory system. Okay, and let's see in the GI system, gastrointestinal system, there may be disorders such as peptic ulcer disease, psychological stress leading to peptic ulcer disease, ulcerations, then ulcerative colitis, esophageal reflux disease, and irritable bowel syndrome. These are the commonest symptoms that can be seen, physical symptoms that can be seen in the GI system due to psychosomatic disorder. And let's see the symptoms that can be seen in the endocrine system. So endocrine system disorders include, there may be diabetes mellitus, there may be hyperthyroidism, there may be premenstrual syndromes in females, there may be amenorrhea in female, and there may be Cushing syndrome. These are the commonest symptoms in the endocrine system due to psychosomatic disorders. Then the person may also experience skin disorders such as eczema, itching, then maybe psoriasis, there may be pruritus, there may be urticaria, and there may be skin rashes. All these may be these symptoms may be exhibited, may be shown by a person having psychosomatic disorders. And musculoskeletal system disorders, there may be some symptoms associated with the musculoskeletal system. There may be rheumatoid arthritis, then there may be back pain, there may be pelvic pain, headache. So any such aches or pains in the musculoskeletal system may also be a result of the psychosomatic disorder. Then how can this be managed? So this can be managed by symptomatic treatment with medications, and their main reason for their somatic symptoms, physical body symptoms, are their psychological stress, the psychological conflicts, psychological problems, and their increased levels of anxiety and increased levels of stress, and their due to all these leading to depression. So the patient has to be treated symptomatically with they have anxiety, anti-anxiety drugs can be administered. Then they have depression, then antidepressant drugs may be administered. Then some general measures such as they need to maintain a healthy lifestyles, then they have to undergo regular and adequate sleep in order to refresh and relax. Then adequate exercises need to be performed. Then they have to take a healthy diet, and if they consume alcohol, nicotine, or caffeine, they must stop or they must reduce the consumption of alcohol, nicotine, smoking, chewing, then caffeine. All these things are these are some of the general measures that can be adopted to reduce the levels of stress and to increase a feeling of well-being. And apart from that, they can undergo psychotherapy, and one of the important psychotherapy that may be most beneficial may be supportive psychotherapy. And they can be, if they have aches and pains, then they can go for physiotherapy, and all these are just symptomatic management. Then stress reduction techniques, the main problem is their increase elevated levels of psychological stress. So stress reduction techniques has to be applied, implemented, and such as relaxation therapy, then exercises, yoga, meditation. All these are going to reduce the stress levels of the individual. So the management include symptomatic treatment with medications, then some general measures, then supportive psychotherapy, physiotherapy, and stress reduction techniques. And so what has to be done in the nursing management? In the nursing management, so establishing a good therapeutic relationship with the patient so as to reduce their level of anxiety. The person may feel comfortable, so establish a good therapeutic relationship with the patient. Then assess the patient's exact problem, what actually is the problem the patient is, what is the psychological stress or problem that the person is undergoing. Assist the patient to ventilate their psychological problem. So assess the patient's stress producing situation. Just assess, evaluate the patient's stress producing. Which are those situations in which that precipitates patient's stress. Okay, and encourage the patient to verbalize the stressful feeling. Encourage the patient to tell about the stressful feeling, psychological stresses. Okay, then help the patient to learn the coping skills. So if they cope the stress, psychological stress, and the root cause is eliminated, and there may not be any somatic symptoms, so that reduces the symptoms of psychosomatic disorders, and provide reassurance, regular frequent reassurances, okay, in order to reduce their levels of anxiety. Then encourage the patient in the repetition of a desired behavior. The desired behavior is the expected behavior, a positive behavior. If the patient shows a positive desired behavior, need to be increased so that the desired positive behavior is repeated. Then encourage the family participation in the therapy, okay, and encourage the patient to use relaxation techniques, mainly physical exercises, yoga, meditation, deep breathing exercises, etc., and that will reduce the level of anxiety and stress, and thereby reduces the symptoms of psychosomatic disorders. And thank you very much. That was all about the psychosomatic disorder. So in that we discussed about its introduction, then we discussed about its definition, group of physical symptoms in which emotional factors or psychological factors have an important role in its etiology. Then we discussed about its etiology. Then we discussed about its clinical manifestations in the cardiovascular system, in the respiratory system, in the GI system, endocrine system, and in the skin, and finally in the musculoskeletal system. And we discussed about the management and the nursing interventions. Thank you very much.